All right, Commissioner Mike Pieciak, thanks for joining me. Thanks for enduring a few technological hiccups. In this era of Zoom technology, sometimes the Zoom gods have forsaken us.
It was just building the anticipation.
Yes, your comments are going to be electrifying, and it just builds up the expectation. And I want to thank everyone for joining me. This is Tim Ashe, President of the Vermont State Senate. It's April 28th, and this is my evening update on Vermont's response to the COVID-19 crisis. In a few minutes, we're going to turn to my guest, Commissioner of Financial Regulation, Mike Pieciak, and he's going to talk a little bit about his role as the chief modeling person for the state as it relates to data that help inform our response to COVID-19. I wanted to begin with just two quick items. The first, at the risk of sounding a little philosophical, every morning I try to read something that has nothing to do with my tenant service. And in the afterword of a book I finished this morning, there was a really simple but powerful quote that I wanted to share, and it was that the difference between hope and despair is a different way of telling stories from the same facts. And it made me think about all of what we're experiencing these last 6 or 7 weeks. And in some ways, we were all facing the same external facts from a public health point of view, the restrictions on our daily living, economic consequences of what's going on. But obviously, we each respond differently to those facts. And that's why the hope versus despair concepts really stuck with me. And I know that many people are not seeing the hope side yet. And so if people are struggling, I really do encourage you to reach out for help, because it is very possible that we see the same facts, but some of us can kind of see the light at the end of the tunnel and others aren't seeing it yet. So please reach out if you need help. Do not hesitate to call any of the warm lines we've set up to make sure you actually can talk to a human being if you're going through any kind of crisis. Talk to your local public health agencies, whether it's a mental health agency or your primary care doctor, but make sure you reach out to people, because we will get to the other side of this, even if right now for many people it doesn't really feel that way. Second thing I want to briefly touch on is I had mentioned yesterday, and I want to mention it again today, that while the number of people who are still waiting to get unemployment benefits or there are benefits under the federal program as self-employed or independent contractors, I still hope you will contact me directly if you have not received those benefits yet, or if you're still struggling to get your application submitted. It's really important for me to know what's really going on out there in the community so that I can translate that into action working with people in state government. So please reach out directly. Many of you have. I wish it wasn't so many of you, because that would mean the problem was further along, but please reach out, because I want to know the truth that behind what's going on. So with that, I'm going to transition to a commissioner in state government who might be in a role that very few people think about in general terms. It's the Commissioner of Financial Regulation. So Mike, thanks for joining me tonight.
Yeah, it's my pleasure. Thanks for having me.
So before we get started with your role managing the modeling for the state's COVID-19 response, just to maybe indicate to people how your normal job would relate to that, tell us a little bit about what being the Commissioner of Financial Regulation actually entails.
Yeah, happy to. So, our department really is focused on regulating the financial service industry in Vermont. So that makes up the insurance industry, the banking industry, the securities industry, like investments, that you might make with your investment advisor, broker dealer, and then also the captive insurance industry, which is sort of a premier industry for Vermont that's sort of unique and specialized. But really what our focus is protecting Vermonters. We're protecting consumers from bad actions of fraudsters, from unfair practices from companies. And we're also protecting consumers by ensuring that those companies that we're regulating have all of the financial wherewithal to be able to make good on the promises that they're making. So whether that's a promise to pay you if you get into a car accident, or to pay your beneficiary if, the unfortunate circumstances come about and, you need to make good on a life insurance policy. We are there to make sure that consumers get the promises that were made to them. So how does that relate to the work that we're doing on the COVID-19 side? We certainly have to do a lot of actuarial work in our job. We have to make a lot of assumptions about, what's an appropriate rate to make sure that those companies are in good financial position. We have to do financial forecasting and financial modeling to make sure, again, that consumers are not overpaying for the products that they're getting, that they're being treated fairly. And all of that sort of background, financial modeling work does play a role in trying to do some of this epidemiological modeling work that we've been working on the last 5 or 6 weeks.
Well, I know that one of the things I've mentioned on one of my updates previously, I believe at the end of last week, was one of your jobs is around auto insurance, and all of the carriers, more or less all of the carriers, recognizing that very few people are putting on the same miles. Obviously, the number of accidents probably way down.
Yep.
And that as a result, we're going to see auto insurance benefits, or dollars returned to us, I should say, from our premiums. I don't know if you want to say a quick word about that.
Yeah, for sure. I mean, this is a great example of how the department is there to protect consumers. So, consumers paid for 12 months of protection, but because of these stay safe, stay home orders, not just in Vermont, but across the country, they're really only buying, let's call it 10 months or 9.5 months of protection. So the fact that, there's that 2.5 months or 2 months where they're really staying at home, not driving, not getting into car accidents, we wanted to make sure our insurance companies understood that was happening, and that also people are struggling economically, and any little bit that they can get to, get them through this month or next month really is impactful. So every one of our domestic insurance companies, stepped up and provided a refund. And as you mentioned, we're about 90% of the way there. There's a few more companies that have to, file a plan with us, but that's about $15 million in savings to Vermonters. So that's a great benefit, we hope, to them, and that it will help them in this difficult time.
Yeah, and as I mentioned on my update last week, if the holdouts don't step up, you let us know, because we'll coerce them through the law if we have to, because it's the right thing to do. So, you've described your department does some modeling because it has to determine whether life insurance policies are appropriately set, things like that. We had a global pandemic kind of heading our way, and many of us started to become familiar with these curved graphs and things. At what point did you realize that Vermont's response was going to need to benefit from the kind of forecasting and modeling that you've subsequently become involved in? When did that become real to you?
Yeah, so I think it really became real to me when we started to look at the experience that Italy was having. Italy was really under some serious strain from a hospital resource perspective. They were having people that were very difficult for them to get into the hospital, to get the treatments that they needed, to get an ICU bed, to get a ventilator. So really, that became quite real when we realized that the modeling work that we would be embarking on would be trying to inform those questions. How many hospital beds do we need in a worst case scenario? How many ICU beds do we need under those scenarios as well? How many ventilators do we need to purchase or to secure? So that was really, I think what made it real was to look at that experience that was happening elsewhere in the world, and realizing, we better get this right. We better make sure that we have good minds on this, because it's fine to have the estimates end up being better than the forecasted worst case scenarios, but it's certainly not acceptable to have it go the other way and have us be short on the resources that Vermonters needed. So we are, fortunate that the trends have been in our favor basically ever since late March, but that was not always the case. It was a daunting challenge to try to figure out exactly what those hospital resources might be.
Well, when people first saw, I think the first time that you publicly, probably at one of the governor's press conferences, the first time you unveiled one of the big charts, and it had, I'm not much of a physical performer here, but there were sort of multiple lines. There was the line that went up here, there's a line in the middle, line that went down representing kind of worst case, middle case, best case.
Yep.
In order to produce those, what, like, the governor turns to you and says, Pieciak, you're in charge of this. What did you actually have to do to create those original projections?
Yeah, so that's a good question. So first, we really looked into.
I only, by the way, ask good questions. So that's a necessary comment.
So we looked internal to ourselves first, and we said, what is it unique and specific about Vermont that we need to take into account, right? So at that time, when we first started modeling, I mean, the only good data that was out there was from a Center for Disease Control study in China that started to estimate what's the percentage of people requiring hospital care and such. So those were some of the assumptions that we were working with, but we had to look at, what's the Vermont population like? And we obviously know that Vermont is an older demographic, that this disease impacts people that are between 60 and 70, and then 70 and 80 or older, much more severely than they do other age groups. So that certainly was a concern, something that's specific to Vermont. We also had to look at, what are the underlying conditions that Vermonters have that will have an impact as well. So we really had to gather that internal data about our state, try to make any projections that we made specific to Vermont. But then it became quite clear, we mentioned how we have expertise and background in financial modeling, but we're not epidemiologists, obviously, and we really needed to go out and find people that were skilled in that type of work that could advise us and give us some good perspective. So we have a company that we work with on a lot of different matters. They're a big national, international consulting firm. They have a life sciences division. And within about 3 or 4 days, we had established a relationship with their life sciences division, and in particular, a partner there that helped the CDC draft their pandemic mitigation and response plan. So she's very expert in these areas. Her herself is not an epidemiologist, but the company has plenty of doctors and epidemiologists on staff. They had a model that they were able to provide us immediately, as well as guidance about some of the assumptions that we just discussed. What's the best thinking, what's the current thinking in the US, internationally as well. And then, that's great, and we felt comfortable with that, but we really wanted to make sure we had multiple perspectives. We didn't want to rely too heavily on any single expert or any single approach, because their modeling approaches are different. So we established a relationship with a professor at Columbia University. And with him, just sort of shows how these things happen somewhat organically. He was featured on the front page of the New York Times on Friday, and this was when we were still in the office, obviously. We hadn't gone teleworking at this time. And someone in my office, brought this to me and showed how, he's being featured pretty prominently in his work and whatnot. So that evening, I reached out to him, shot him an email, asked him if he'd be willing to work with us and consult with us. And that weekend, we had an hour-long conversation. He was very open. I asked him, do we need to enter into a contract with you? And he said, no, this stuff is too important. We're providing this basically to the extent that we can. We're providing this, free of charge. That right. Policymakers and such need to be as informed as they can be. And he wanted to do everything that he could. So that's an example of another relationship that we established pretty quickly. And then we added a few more as we decided that we wanted to bring in a couple of different perspectives. So we have about 4 different modelers that we're working with. We think that's a good bunch, that they can, some rely more heavily on mobility data, for example. That's a real sort of important underlying assumption in their modeling. Some focus really heavily on the mortality rates. So that's a different approach as well. So we think by reconciling and working with a couple of different perspectives, we're able to most accurately predict, the timing and then some of the worst case scenarios that we could have seen if, A, if we delayed some of the actions we took, or 2, or B, if Vermonters weren't as compliant with the stay-at-home orders as they have been.
So you took a bunch of approaches to modeling and kind of averaged them out a little bit so that if one relied too heavily on one factor, it would be offset by the others. Is that pretty much?
I think that's right. I mean, as you can imagine, fortunately, I mean, we've been relatively low in some of the worst metrics like ICU and ventilator need and mortality as well. And some of the models rely really heavily on that data. So when we have very small numbers, the data is not quite as accurate. So we wanted to have the benefit of their approach, but we didn't want to rely too heavily on it. So exactly right.
Yeah. So when you first put together all of these contributing models to arrive at the one that you present publicly and to the governor privately, what's the scariest thing that popped out to you when you looked at that? Because you're numbers crunching, and sometimes it looks like numbers on a page, but then when you start to look at the actual information and say, well, wait a sec, there's actually human lives that are being represented visually here. What was the scariest thing when you first looked at that?
Yeah, I think the scariest thing was when we looked at that ICU and ventilator need, right? Because that was obviously a critical need across the country as well. But when you start thinking about it on a Vermont level, and you start thinking about rural healthcare delivery, you start thinking about your own friends and family that maybe are in rural parts of the state, and then thinking about is there going to be enough capacity for them? Are there going to be enough ventilators for everyone in Vermont who needs one? And early on in the modeling, early on in the pandemic, we hoped so, and we were working to make sure that that was the case, but we didn't necessarily know for certain. So that was certainly a really very vivid and big wake-up call that that we didn't know if not just Vermont, but New England and the country was going to experience, sort of this Italy scenario, or whether we were going to be able to sort of get in front of it and have a better outcome.
And so you've alluded to it a little bit. You've got that kind of worst case scenario in your mind about not being able to access needed equipment, surge of cases that really put it to the test. Now that now that we're April 28th, looking back, what's your takeaway overall of how we've fared compared to what you were looking at back in mid-March?
Yeah, so really well. I mean, the short answer is we've performed really well, and why is that? When you look at mid-March, you look at late March, you look at early April, and where we are now. Our growth rate continued to slow down. I mean, it really slammed on the brakes in late March. And when you go back basically 14 days, because that's the time frame it takes, basically on average, somebody to get exposed to the virus, to have the symptoms, come about, to have the symptoms worsen so that they go seek medical care. They get the test takes a day to process, and then they get the result. So basically you add that all up and it could take 14 days. So it's a lagging indicator of those test results. But once we had implemented, and the governor had implemented all of the various social distancing measures, we really saw those numbers slam on the brakes about 14 days later. And that's attributable, obviously to early intervention, but it's really attributable to all the sacrifices Vermonters made. We have this information, we have this data, we call it mobility data. And really, whenever you go download an app, whether it's Waze or some other app on your phone, and you say, yeah, I'll share my location with you, these companies on an aggregate and anonymized basis, so nobody knows who the individual people are. I know from a privacy perspective, some people have some concern, and rightfully so. But this is aggregate, anonymized data about people throughout the country, and we can really compare ourselves in Vermont to other places in the country. And we've always performed very favorably on these metrics. We usually have the best mobility data in New England. Oftentimes, we're the best in the country. So really, what that tells us is that Vermonters are highly compliant with these orders, which is so critical to having the outcome that we had. If it wasn't for that sacrifice, if it wasn't for that diligence, we would have had a much different outcome. So it's something that I think everybody listening tonight or watching later on can be really proud of, that their friends, their family, people in their communities, all were looking out for each other and realized, this is a tough sacrifice, this is a tough way to live, but I'm doing this because somebody in my community really can't have this virus. Somebody in my family really can't have this virus because they're going to have serious complications if they get it. And people really came together and had a collective response. So it was really great to see.
No, I'm in total agreement with you there. There's a certain selfless quality to putting severe restrictions on your own life, knowing that it'll benefit someone you might never know or ever, you know what I mean? It's just
exactly right.
Putting the public in the term public health, and implying that we take responsibility for our own actions because it will benefit others in a more global sense. So I think you're spot on. Have there been any moments, there may be people who say, wow, Pieciak, he seems like he's good with numbers, the projections, tell a good story, but in a sort of war room metaphor, have there been moments where you've been able to present to the administration, meaning the governor and the rest of his team, and say, here's where we're at right now, and that you could see quite quickly that a decision was made about either more restrictions or easing up of restrictions based on the projections and modeling that you've been doing?
Yeah, so originally our purpose of our forecast and modeling was to develop the estimate for hospital resources. So you can see, examples in that instance where we said, hey, look, our most recent projection says that we need XYZ number of ventilators, and the next day, ventilators are purchased so that we have the capacity that we need under a worst case scenario. So there certainly are examples where, that kind of decision making obviously was played out very quickly and in a real tangible way. So obviously, as we have sort of crested at the peak and we're sort of on the downside, now the question is, how can the modeling help determine how we reopen Vermont and how we do it strategically and smart and wisely? So now the decision making in terms of releasing social distancing measures plays more closely to the modeling. Originally, the purpose of the modeling was really to focus on the hospital resource capacity. But now we're sort of tasked with the second phase of the effort, which is, how do we keep an eye on this growth rate? How do we keep an eye on risk that we might experience as we start to slowly open up the state's economy and people slowly start to get back to life under somewhat normal circumstances? So that will be, again, another challenging exercise. We, not just myself or our department or the state, people in public health and epidemiology had never experienced anything like we just experienced. Similarly, no one has ever experienced coming out of something like we just experienced. So again, we're going to.
I was going to say, on the one hand, I'm tempted to say, what does the modeling tell us looking forward? But it sounds like what you're saying is the modeling will actually be a tool to help us make decisions moving forward, thinking more in terms of keeping people as distanced as possible so that we do so safely. And, I know one of the worries, especially as the weather gets warmer and people become more stir crazy, is that even if we're just easing the restrictions slowly, that people will return to their normal course of life. I will tell you anecdotally, I went for a run earlier today, which I have to do to stay sane right now. And I saw 3 different work crews, people working within a couple feet from one another, none wearing masks, and it gave me a lot of worry about the need for people to continue to stand by the public health guidance. And so is that the type of thing that you will be focused on moving forward, analyzing the mobility data and some of those other factors as a way of determining when it's safe to keep opening up parts of our economy?
Yeah, exactly right. So, the mobility data will be key, as you point out. We're going to see our mobility data change, right? Because people are going back to work ever so slightly. So we'll see that, but we want to make sure that those are the kind of visits that are consistent with going to work, that they're not just people sort of out socializing or getting sort of stir crazy, as you point out, which is very real. And there's articles published about quarantine fatigue, that's setting in, and we understand that and totally get it. And in fact, Vermont has been, even still in these waning weeks, has still been rather compliant with these social distancing measures, which is great to see. So that mobility data will be key. Another thing we'll be looking at is, I mentioned that 14-day lag in the number of tests and sort of the experience on the ground. So from April 20th, which was the first step forward in allowing 2-person crews or 2-person operations to get back at work, we'll look 14 days out, which will basically be the end of this week. Have our cases changed at all? Have we seen a spike in cases? And if we have seen a spike in cases, is it worrisome? Is it the type of population that concerns us? Is it a high risk demographic, either by age or underlying condition? Also, even though the cases have gone up, what do the hospital trends tell us? Because the hospital trends have been good as well. Last week we had maybe 29 people in the hospital. This week we're down to almost single digits. We're down to 11 people in the hospital. So we want to keep seeing those trends going down as well. So even if we see a little increase in the number of cases, if those other trends hold steady, then that tells us a good story. So those are the kind of things we're going to be looking at in the future, trying to understand what's the impact of these various policy decisions.
That's great. And I suspect that you may not wish this to be the case, but it seems to me that you may become slightly more prominent in the weeks ahead, at least in terms of joining the governor, communicating what comes next, because, as you're saying, many of the metrics to determine whether we can safely resume many of our activities will increasingly be about people's compliance with social distancing, more so than possibly the number of positive tests on a given day. I mean, we've actually seen in the last 3 or 4 days something like 25 to 30 new positive tests, which on the one hand is not a good sign, but we've also seen a drop in the number of hospitalizations,
Right.
which is the worst sign. So, well, it's a good sign that it's going down, but it's the worst metric if it's going the other way.
Right.
So we've got another second or two. I'm just curious. We're not out of this. We're week. I don't know. The weeks have sort of gone. I can't even keep track now. But let's say we're week 6 or 7. The stay-at-home order, I think, was the 24th of March. So we're in the 5th or 6th week of the stay-at-home, which is what has really restricted the most people. But you've had every day for you, I'm sure, is like a marathon. And wondering if at this point, even though we're sort of midway through this, have there been any moments when, over the course of the last bunch of weeks, that stand out to you as on a personal level as having been particularly powerful moments that will stick with you when we're long past this?
Yeah, so I mean, a couple come to mind. I mean, just recently, just a week ago, we put out a call for volunteers at our department that wanted to assist with the Department of Labor and the issues that they're having on the unemployment insurance call center. And our department's already doing a lot of work in this regard, not just the COVID-19 response that we've been talking about, but our financial institutions are under stress, our insurance companies, our banks, our credit unions are under stress. We've been working with all of them throughout this. But even still, we got 20 people from our department that volunteered and said, I'll do it on the weekend, I'll do it on the evening, I'll do it full time. And that was just an example, I think, of our state employees across the board that want to step up and want to help and do good work, and they're public servants, through and through. So that was really heartening to see. And I'm sure there's examples of that in every agency and every department across government. I think of the governor as well, and he talks a lot about how we're in this together as a state, we're in this together as a region, as a country, and a global community as well. I think that is a powerful message. But I remember an evening when he asked if I would help consult with another state that he had been talking to about how we've approached our modeling, and I said, sure, I'd be happy to. And he just texted back that, we're all in this together. And it was just a powerful moment, because it wasn't just a talking point. It's not just a talking point for the governor. It's really a principle that he's leading by and living by. And I think that was really heartening to see as well, that, we have such a quality person making these decisions for our state. And that certainly put me at ease a little bit more. And I'm sure the same is true for Vermonters that watch the press conferences and watch the decisions that are being made in Montpelier. I think the government all around in many ways has stepped up. And then, of course, just the Vermonters. I mean, we wouldn't be having these better results without Vermonters and the care that they have for each other and their communities. It's really been, that part of it has just been really powerful. I mean, the task of trying to get our hands wrapped around just our piece of this work, let alone the whole response, could seem overwhelming and could seem challenging, and it was. But again, knowing that we have 639,000 or 629,000 people there ready to chip in and pitch in and do their part, I mean, it makes this a lot easier, and really, we all really appreciate that.
Well, I'm sure you didn't hope to have your notoriety increased as a result of working on a pandemic in our state. But I think you've been doing a great job. And I think your description of the governor as it's related to this crisis is a good one. I've had significant policy differences. We've had difficulties on budgets and public education and so on. But on this, the sincerity that you just described in that anecdote is precisely what I've seen every time I've talked with them over the last number of months. And so it is, people talk about Vermont exceptionalism, which gets a little tiresome sometimes because we fail to look outside of our borders and see that sometimes we're not as exceptional as we think. But in terms of people banding together, I think you've pointed to hard to ignore data, which suggests that people are doing exactly what has been asked of them for the greater good, which I think is exceptional. So thank you, Mike, for everything you're doing. And you're not done yet, so we're going to keep driving you until we're on the other side of this. But all of your efforts and your team have been greatly appreciated, even by people who might not appreciate, precisely who's doing this modeling work and why it's so important. But I think you've helped really shine a light on that in our discussion. So I'm going to thank you and let my viewers know that we've had some technical issues tonight. You know, this is a Zoom situation, which is, I think their name recognition has gone from 0 to 100% in like 6 weeks. But I'll be back tomorrow. I'm going to have a guest tomorrow from the Randolph Technical Career Center, Jason Gingold, who is going to talk about what it's been like to convert the teaching of their students and making it go over to remote learning, and whether that's been a success story, what the challenges have been, what it means for continuity of education for kids, which I think will be something that speaks to the whole public education system and their need to transition almost overnight. So I hope you'll join me for that, and want to continue to encourage. I think the best thing you can do to thank Mike Pieciak for the great work he's been doing is to continue to follow the public health guidance to put him out of this part of his job so he can focus on getting your money back on your insurance policies. So thanks a lot, Mike, and keep up the great work.
Thank you, Tim. Thanks for having me.